Today in Leeds, campaigners are coming together to hold a rally and a march to try and encourage ever more people to support the demands for the continuation of the National Health Service and additional funding so that it can continue to do the marvellous service which it has provided for the British public since 1948.
I'm here today because the NHS is 75 years old. It protects everyone, and that means people don't have to pay to get healthcare. I have been on the NHS march before in London. I think it was quite a while ago now. I think I was about 4 or 5 years old then. My mum had cancer, so she had to use the NHS a lot, so they really helped her, yeah.
As I march through Leeds today with you all, I reflected upon the foundation of our National Health Service, because people march in this country demanding the creation of a National Health Service that puts people's health before profits. And even though some people argued after the Second World War there was no money left, there was the political will in this country, and with the 1945 Labour government to create the NHS, which we celebrate today.
The National Health Service is 75 years old on the 5th of July 2023, when it was formed by a radical Labour government after the Second World War in 1948. It was the first public service to be based on the need for healthcare and not on the ability to pay. Sadly, this principle was broken fairly quickly with the introduction of charges for dentistry and for glasses. Nevertheless, the National Health Service has remained immensely popular for the 75 years it has been in existence. In 2010, satisfaction levels for the NHS were at an all-time high. This was because the new Labour government of 1997 to 2010 had put significant amount of resources into the service. The weakness of that is that much of this was put into the private finance initiative, whereby private companies not only built hospitals and new wards and new units, but also took over the management of them. And this has left a considerable debt, 6 times as much as would have been the case in interest repayments if the services had been built and managed by the public sector. Since 2010, the Tories, initially in conjunction with the Lib Dems, have been in government. And since then, investment has fallen. Whilst the investment that has been made, much of it has been used to employ the private sector. The target that 90% of people who visit the accident and emergency departments should be seen within 4 hours has not been met since 2015.
I've been a nurse for 25 years. We are chronically short-staffed, and we've got a 48,000 just nurses vacancy. 8 in 10 shifts are understaffed. It's just incredible. We're having to make choices between who needs the pain relief first. Just choices that we should not have to make. You know, we were the world's top first class health system, and we are rapidly falling to probably the very bottom. All disciplines under Agenda for Change have been subject to real terms pay cuts, which now at the moment stands at around 20%. And that has had a massive impact. A number of my colleagues have left nursing altogether. Throughout COVID, I think it was the Thursday, everyone stood on the doorsteps. The then Prime Minister stood on the doorsteps and clapped, but claps don't pay the bills. People started to realise just what we do in the NHS, because we are quite a place, you know, we make people better. I'm a Royal College of Nursing steward and a striking nurse, and I've been on strike every time. And the public support is amazing. The Royal College of Nursing gives us that voice to get our voices heard, our voices lifted, and tell the government what is going on and what it is that we need to make the NHS a safe place to be for patients and staff.
So I worked in the NHS for 40 years or so. When I was a medical student, I was really proud to be joining the NHS, and I imagined it was something that would always be there. And of course, over many, many years, we've seen slow undermining of the NHS, and I think that's really wrong. And so now I campaign full-time for the NHS. I'm co-chair of the National Keep Our NHS Public and chair of Leeds keep our NHS public. Underfunding, we know, is a huge problem, although it's not really admitted by government. They say they put more money in than ever before, but if we compare ourselves with other rich countries, we've been investing about 40 billion a year less in healthcare, and this needs to be rectified. Under a new Labour government, I mean, we would hope that things would be better, but at present there's nothing terribly exciting. I mean, one was an increase in workforce, but now the Tories have come up with the same plan. But there needs to be much more long-term investment, and they're not promising that. Instead, they're talking about a shift of care from hospital to community. Well, that's been in every health policy document for about 30 years. Also talking about technology. Well, clearly the NHS is always willing to embrace new technology, but that's not going to transform the situation when you've got 120,000 staff vacancies. I am concerned that opposition party members and some of the executive actually are taking money from private companies. I mean, I think it sends out completely the wrong signal.
Well, the NHS is important to me. It's saved my life on at least one occasion. It's a jewel in the crown of our country, and it needs cherishing and supporting, which it has not been for the last 13 years, and it is in peril.
Congratulations to all the NHS campaigns that have done such a fantastic job, and solidarity too with all the trade unionists in our NHS who have been fighting for fair pay. There is a crisis in our National Health Service. The Tories would have us believe that perhaps it's due to migrants. What a load of rubbish. If it wasn't for migrants, our NHS would have stopped working years ago. The Tories may try to make you think it's about people who claim social security. What a load of rubbish. Those who aren't paying their fair share towards the collective pot that is our NHS and our welfare state are the super rich and the millionaires at the top. We need to accept that the real reason for the crisis in our NHS is 13 years of chronic underfunding, and also this drive towards the final privatisation of our NHS. Tory MPs are talking about the fact that they believe that the crisis in our NHS is so great that we need to look at alternative options. The alternative option that they have in mind, this party that voted over 20 times against the creation of a National Health Service, is simply an American-style private insurance scheme model where they feel for your wallet before they feel for your pulse. As a socialist and a trade unionist, I'd say the foundation of our National Health Service was the greatest example in our country's history of socialist principles put into practice. The idea that there are some things more important in life and in our society than the pursuit of profit. Why can't we have a wealth tax on the assets of those who have over £10 million in assets? That would help fund a decent pay rise for all our NHS workers and all our public sector workers. We also need to look at the question of the reason for the record waiting lists in our NHS. It's not just due to Tory chronic underfunding, it's due to the whole Tory project of austerity. Because of course, poor people are going to be unwell if there's a housing crisis, if there's poverty in terms of food, and that's why we need to argue for free school meals for every single school pupil in this country. That's why we need to argue for rent caps. That's why we need to argue for a mass council house building programme. And Ivan Bevan, minor trade unionist, socialist, Labour MP, founder of our National Health Service, is said to have said, the NHS will exist as long as there are folk who have the faith to fight for it. The question is simple. Do we have the faith to fight for our National Health Service? How are we going to protect our National Health Service?